Okay, these are the last part of the Unit 1 condensed slides, part of our AP review, the ones that I ran out of time for in class, and these are on sleep and dreaming and drugs. All right, so when it comes to sleep, the big thing that we want to learn about or remember about was the circadian rhythms. They're on a 24-hour schedule that are controlled by our hypothalamus, but they're influenced by our exposure to light. Circadian rhythm primarily affects sleep-wake cycles, but other things including our coordination and reaction times, blood pressure, our bowel movements, our stomach digestion are on circadian rhythms, but especially they regulate when melatonin secretion starts and when it ends, and that's what makes you feel awake and sleepy, or different times a day. Seasonal affective disorder is a seasonal problem where people are exposed to more darkness in the winter months, and because they're not getting enough sunshine, it causes them to have depression symptoms, which is cured by sunlight, but also light therapy. A way to look at brain waves while sleeping is through an EEG. We talked about those a little bit earlier in the section. Comparing brain waves when we're awake, they're short, fast waves. You also see those same waves during REM sleep. Deep sleep, stages 3 and 4, have these large, slow delta waves. So during stages 1 and through 3, they're considered quiet sleep. We have sleep spindles, which are short bursts of brain activity. Sometimes you might be like just dozing off to sleep and you kind of flinch a little. Those might be sleep spindles. But stage 1 is when you're just drifting off to sleep. All of these are called non-REM sleep. In the more recent studies, they've eliminated stage 4, and stage 3 and 4 are combined to just being stage 3, which is deep sleep. So here we have, in this diagram, it still has stage 4, but we start with awake, we go 1, 2, 3, 4, but then you go backward through the sleep stages, 3, 2, 1 REM, 2, 3, 4, 3, 2, 1 REM, 2, 3, and then you drop the later stages later throughout the night. REM sleep we know is very important. We call it paradoxical sleep because you're asleep, but your brain is very much awake. Lots of things happening during that time. Our most vivid dreaming happens, the release of growth hormones, and memory consolidation happens. Also, getting lots of REM sleep is really just what makes us feel rested. It also tends to boost our immune system. Again, the brain waves look very similar during REM sleep, rapid eye movement sleep, as when you are awake. Some areas of the brain that are more active when we're asleep, the ascending reticular activating system. We know the reticular activating system alerts the brain to incoming signals. The pons we know for sleep, the hypothalamus because it's releasing hormones through the endocrine system. Neurogenesis, we've talked about this term before, is the growth of new neurons. You're primarily born with all the neurons you're going to get. You have 86 billion neurons, but recent research tells us that there is a little bit of new neuron growth during REM sleep. So we talked about that if you're sleeping in class, one benefit is that maybe you're growing new neurons, but still don't sleep in class. REM rebound is what happens when you are not sleeping enough, and then when you fall asleep, your brain shortens the other sleep stages so that you spend more time in REM sleep. So you're rebounding faster into that REM stage because your body is craving the rest. Next section on sleep theories and sleep disorders. A few reasons why we sleep. It's a chance to protect us. So evolutionary perspective would say that during darkness is when predators were out. It was dangerous to our ancestors, so we would sleep during that time instead of being out and about. Sleep is a chance to recuperate, helps your body restore and repair the brain. And then sleep helps remembering because it helps sleep us to get rid of memories that we don't need, purging unimportant information, and consolidating the memories that we do need. And then finally, it's important to sleep in growth, especially in children, because that's when the pituitary gland is releasing growth hormones. Older people release less of that hormone, so that's why they tend to sleep less, is because they're not trying to grow anymore. Some sleep disorders. Insomnia, we know, is when a person has trouble sleeping. They may have trouble getting to sleep, they may be able to fall asleep, but then have trouble staying asleep, or they have trouble returning back to sleep after they wake up. What is the cause of insomnia? Probably an overactive autonomic nervous system, so their fight or flight response is a little bit activated, keeping them awake, higher anxiety levels, and just kind of physical complaints throughout the body. Narcolepsy is when a person suddenly has overwhelming sleep attacks, which is a rapid onset of REM sleep. Some people do actually fall into REM sleep, whereas other people just feel really, really tired. Sleep apnea is a physical problem. It's caused by a physical abnormality or deformity, but basically the person stops breathing lots and lots of times throughout the night. It's sometimes or commonly a symptom or a side effect of being overweight, because when a person is laying down, all that extra weight puts pressure on their airway. But sometimes it's also just the shape of a person's airway. The main characteristic is a loud snore where the person has stopped breathing and then a sudden loud snore. Treatment for that is a CPAP machine. REM sleep behavior disorder. Normally your body paralyzes your muscles while you're in REM sleep, but with REM sleep behavior disorder, you are acting out your dreams. So it can be very dangerous to people who have that and to people who may be sharing a bed with them. Night terrors is like nightmares, except they're mostly happening earlier in the night, like during the first sleep cycle of the night. And people tend not to remember them. Sleepwalking, people are roaming around at night. It is a myth that you can't wake somebody up. In fact, you should wake them up because they could hurt themselves roaming around, or they might think they're in the bathroom and pee on the floor. The formal technical name is somnambulism. Sudden infant death syndrome is not a sleep disorder, but rather a very scary thing where an infant suddenly stops breathing in the night and they pass away. For a long time, we didn't really know what the cause was, and we're still not totally sure, but scientists say that their nervous system is underdeveloped, and for some reason, their breathing response is not taking over automatically. One of the biggest things that has helped to cut back on the number from SIDS is by having moms put babies to sleep on their back so they don't suffocate in the crib. Dreaming, we used to think that dreams only happen during REM sleep, but we know now that dreaming happens in all sleep stages. Really the only way to tell if somebody's dreaming is to actually wake them up and ask them if they were dreaming. You can't actually tell on a brain scan. But we think that the dreams are more vivid during REM sleep because that's when the amygdala tends to be more active. And we know the amygdala is our fear and aggression and anger part of the brain. The dots on here indicating when dreams happen. So throughout the night, but especially during REM stages. Some theories on why we dream. Freud said it was a time of wish fulfillment, time to satisfy the urges of the unconscious mind, and a lot of things in your dreams were sexually related. The problem-solving view says that our dreams are a chance to kind of relive the struggles that we had in the day and address problems that we couldn't solve earlier. And the most likely is the activation synthesis model that says we just have random neural firing throughout the night, and our cortex tries to make sense of it by constructing a story based on all those lower brain signals. All right, the next part, or the last part, are psychoactive drugs, which are all chemical substances that can alter perception and mood. They affect consciousness, and they're all interacting with neurotransmitters in the neurons or in the synaptic gaps. Psychoactive drugs are included as agonists that mimic neurotransmitters and antagonists that block neurotransmitters. With drugs, a person can develop tolerance. Tolerance happens when a person is repeatedly exposed to a drug, so the effect of the drug lessens, so then it takes a bigger dose to get the desired effect. That can happen with something as simple as caffeine, but also with something as much more significantly dangerous as cocaine. A person who has a dependence, where their body is now depending on that drug, can also develop withdrawal symptoms when they stop using it. So a physical dependence is caused by chronic use. So your body becomes tolerant to it. Often it stops creating the natural chemicals because it's being replaced by the drug. So it creates an addiction. Some drugs don't create an actual physical addiction, but rather a psychological dependence, but it can be just as intense and still have withdrawal symptoms. Symptoms of withdrawal: when a person stops using drug, they feel tired. Headaches and tremors, sweating and vomiting are probably the most common ones, but there's also psychological symptoms. So for example, anhedonia, where they basically, especially with things like cocaine and heroin, where they were getting highs all the time, is that after they've stopped taking the drug, they can't feel pleasure the same way they could before, because their brain has kind of quit making those dopamine chemicals for them, or at least to a lesser extent. Three main categories that we look at for types of drugs. The depressants are ones that reduce or slow neural activity, primarily alcohol, barbiturates, and opiates. We know that alcohol slows neural firing, which you cannot actually slow down a neuron, but you can cause it to fire less often. Alcohol does affect memory. You hear of people who pass out and they can't remember what happened the night before. Barbiturates are often used as sleep medications because they slow down the central nervous system. Again, can be very dangerous when mixed with alcohol because they would be double slowing down the nervous system. Rohypnol, known as roofies or the date rape drug, is a depressant. It can produce amnesia and cause a person to pass out or black out. Opiates block pain, so they're prescribed for people as morphine, especially when people like break a bone or they're having surgery. So it blocks pain, but they are highly addictive. Heroin has the same response. It creates the high, but then they become highly addictive. Let's see. Stimulants are in the next category. A stimulant excites the nervous system, revs the body up, or speeds the body up. They include caffeine, nicotine, so people often will smoke cigarettes to kind of wake themselves up. Cocaine, ecstasy, amphetamines, and methamphetamines. Some other ones that are listed on here, Ritalin and Adderall, can also be considered as stimulants. Again, caffeine can be physically addictive because it can also create withdrawal symptoms. Amphetamines will suppress appetite, so somebody who is addicted to meth often looks very thin because it reduces their desire to eat and it keeps them very energized. Another side effect is meth mouth, where it destroys their teeth. Cocaine, another stimulant, creates a high because it is enhancing the effect of dopamine. Ecstasy, MDMA, acts on serotonin and other ones, but it kind of affects their overall mood, seen as a club drug. But the danger with that one is that people can become dehydrated and then memory loss also. Hallucinogens are psychedelic drugs that can create a trip and alters in their perception and sensory images. They include LSD, which is commonly just known as acid. It takes very small amounts, which is why it's also so dangerous. Bad trips can last or can be very scary, but they can also happen later on after the drug is already out of their system as flashbacks. And then finally, marijuana fits into the hallucinogen category, produces feelings of elation. It helps people to feel relaxed, and that can help block out pain, which is why it can be prescribed for its medicinal purposes, but it can contribute to memory loss. It does impair attention and coordination, so it's not safe to drive, and that's why even in states where it's legalized, it's regulated the same way alcohol is, and that people have a certain age can't do it, but also you cannot be under the influence of marijuana while you're doing things like driving or caring for children. All right, that's it for this Unit 1 section.